In this video, we're going to cover 10 reasons for potentially having a painful penis, the symptoms to watch out for, and potential treatment options. But before we get into the reasons, it's important to state that if you've got any worries or concerns about the health of your penis, then please go and see a doctor. Please don't be embarrassed about any of the issues that we're going to discuss today, and please do remember that your doctor is there to help you and not to judge you. So with this in mind, the first reason for a painful penis might seem obvious, but infections are a very common cause of pain in the penis. Infections can lead to redness, swelling, and discharge from the tip of the penis. You might also notice an itching or burning sensation when you go to the toilet to pee. Now, whilst infections of the penis can be caused by sexually transmitted infections, also known as STIs, like gonorrhea, chlamydia, and herpes, they can also be caused by non-sexually transmitted infections too, so things like yeast infections. Now, to treat infections, antibiotics, antiviral medications, or antifungal creams are often necessary, and it will depend on exactly which infection is the cause as to what treatment you're going to be prescribed. Now, if pain in the penis is because of a sexually transmitted infection, then practicing safe sex, so for example using condoms and keeping up to date with regular sexual health checks, is really important. And for more information on where to find a sexual health clinic near you in the UK or the USA, please do see the description box of this video. Now, the second reason for a painful penis is injury or trauma to the penis, and this can happen from bending the penis in an abnormal position during sex, accidents, or excessive masturbation. Symptoms can include bruising, swelling, a sharp or dull pain, as well as possible bleeding. Now, rest, using an ice pack wrapped in a towel, as well as over-the-counter pain relievers can help, but severe injuries might need medical intervention. So again, if your penis is very painful, or if you've got any concerns, please don't be embarrassed to go and see your health provider who can properly assess it for you. Now, Peyronie's disease is our third reason. This is a condition in which fibrous scar tissue forms in the deeper tissues under the skin of the penis, and this causes curved, painful erections. Treatment options can include medications, physical therapy, and sometimes surgery to help with this condition. Now, our fourth reasons are actually two separate reasons. These are phimosis and paraphimosis. Phimosis is where you can't pull back the foreskin, which is the skin covering the head of the penis in uncircumcised men. Now, this can lead to pain during erections or difficulty going to the toilet to wee. On the other hand, paraphimosis is when the foreskin gets stuck behind the head of the penis when it's pulled back, causing swelling and severe pain. Treatment can include topical steroids, so steroid creams that you rub onto the penis, gentle stretching exercises, or surgical procedures like circumcision for severe cases. Balanitis is the fifth reason and involves redness, swelling, itching, and discharge from under the foreskin, typically affecting the head of the penis. Now, balanitis can be caused by poor hygiene, infections, irritants like shower gels or creams, or underlying health conditions like diabetes. Now, to treat balanitis, it's typically suggested that you can improve your hygiene, use antifungal or antibiotic creams, and in some circumstances, circumcision if you get repeated episodes of balanitis. The sixth reason is urethritis, which is characterized by a burning sensation when you go to the toilet to pee. You might also notice discharge from urethra, which is the opening on the head of the penis where urine comes out of, and you might also find the need to go to the toilet more often to pee. Now, urethritis is typically caused by bacterial infections, so it could be gonorrhea or chlamydia, or even chemical irritants. Now, treatment includes antibiotics or antiviral medications if necessary, making sure you drink plenty of water, and avoiding any irritants if this is the cause. Prostatitis, which is the seventh reason, causes pain in the penis, the perineum, the lower back, as well as causing difficulty urinating and other such symptoms. Bacterial infections or long-term non-bacterial inflammation are typical causes, and it's more common in older men. Now, treatment includes antibiotics, anti-inflammatory medications like alpha blockers, as well as lifestyle changes. Priapism is our eighth reason, and this is a prolonged, painful erection that lasts for more than 4 hours, and it is not related to sexual arousal. And it can be caused by blood disorders like sickle cell disease, medications, or trauma. Now, if you do have an erection that has lasted more than 4 hours and it's not going down, then you need to seek immediate medical attention, and treatment might involve draining blood from the penis or medications to reduce the erection. The ninth cause are allergic reactions or irritants, which can cause redness, swelling, itching, and pain of the penis. And this can happen when the penis reacts to things like latex condoms, soaps, lotions, or things like detergents. Now, the treatment for this involves identifying and avoiding the allergens, as well as using antihistamine medications, which you can get from the pharmacist. Now, finally, whilst it is rare, cancer can cause pain in the penis. I've made a separate video elsewhere on this channel on penile cancer, but it can present as sores, lumps, unusual discharge, persistent pain, or changes in skin colour or texture. Penis cancer has been linked with HPV infection, smoking, poor hygiene, as well as chronic inflammation, and treatments can include surgery, radiation therapy, and chemotherapy. Now remember, if you do have pain in the penis or anything that is not normal for you that isn't going away, or you're facing any of the issues that we discussed in this video where I advise to seek urgent medical attention, then please don't hesitate to see your health provider.